How do you stay positive?
Dr. Rainier Tahar's commute to work takes just a few minutes.
Sometimes at night, when they call me for an emergency, it goes a bit faster.
Sure.
Sometimes on the bicycle.
Yeah.
Dr. Tahar started as the medical director of Nkoma Hospital in Malawi in 1996.
So I've worked in the West, I've worked in Canada and in South Africa and in England. But I think what I do here makes the biggest difference.
As medical director, Tahar hired Dr. Catherine Hodge to solve a problem.
The hospital approached me and asked me to consider opening a neonatal unit because they recognized that it was just a missing piece of the hospital care.
They do what they can with the little they have. Babies sleep 5 or more to a bed. The smallest sleep in makeshift incubators.
We designed this box which just has warming light bulbs underneath, and since then I don't think we've ever had a hypothermic death.
Yes, even during an African summer, underweight babies die of hypothermia. Hodge was obviously the perfect person for this 2-year journey, but she had to go through an emotional learning curve along the way.
A lot of grief because in the States I had never seen a child die, even once. And then with time was able to move to this new role of setting up a really heartbreaking unit, but one where there's also a lot of hope because the 33 babies that we have in this ward today would have had no chance a few years ago, most of them.
To understand the magnitude of the healthcare crisis here on the African continent, you just need to look at the doctor-patient ratio. For example, in the United States, there are about 400 patients to 1 doctor. Here in Malawi, get this, there are 50,000 patients to 1 single doctor. The focus at this teaching hospital is bringing up national doctors. Daniel Chimutu started out as Dr. Tahar's gardener.
My dream is to become an orthopedic surgeon.
They're also currently training 300 nurses at Nkoma. Olive Simbani finished nursing school a while ago. She's been at Nkoma for more than 30 years.
You know, when you've got a child who is very sick at the beginning, and then in 2-3 days' time, you find that child smiling at you, coming to you, you know, that you feel good that you have done something nice.
As you can imagine, living in a rural community like this can be difficult, both at work and at home.
The electricity is probably the most common challenge we have. Also the water needs to be pumped from a river 5 kilometers from Nkoma.
So one of the many goals at the hospital is to keep the people they train to stay in that rural, often frustrating setting.
We hope that it's their Christian conviction that brings them here and makes them stay. We also try to give them a decent housing.
Plans are currently underway to build a number of small apartments to offer more staff low-cost housing.
You know, nursing is a passion, so if people have got that passion to work, and looking at how poor people here are, you can stay and you can still go on. So I feel this place is ideal for a Malawian woman.
And it's ideal for doctors like Tahar, not for the salary or the luxury or the amenities, but for the necessity.
The next town is 50 kilometers from here. In an emergency situation, that could be the difference between life and death.
George Thomas, CBN News, Nkoma Hospital, Malawi.